here with Robbie Katter. Thank you so much, Robbie, for coming out. We've just been speaking at the Cherish Life March.
Just trying to follow your lead.
Okay. Oh, you're too nice. All right. I think we're starting to see each other a bit now.
Yeah.
On this stuff. All right.
You're not so challenging to me now.
No.
We're starting to know each other a bit better.
Yeah, that's true. That's true. I told a story at the speech we just gave about how I put Robbie through the ringer when I first met him, and grilled him on whether he was genuinely in the right place on this stuff. I think now that we've known each other, I can tell you that.
Yeah,
So,
which on the record for now,
Yeah.
I was a little bit offended by, but we're over it.
Yeah, we are over it. We've moved past it. So the reason I wanted to chat with you today is to update all of us on where your bill's at and what's going on. There's been a bit of shenanigans. We were meant to have an oral hearing on Monday.
Yes.
For your Babies Born Alive bill. What's happening now?
Yeah, so it's been put off to August the 2nd?
19th, I think it is.
Oh, 19th. I was going to say 1st or 2nd. August the 19th. So they're trying to use every device possible to kick the can down the road, silence, suppress, because like I get, it's a manifestation of what we deal with in society generally. And let's not have the debate. Let's not talk about this because it's really important that we don't have to show our values and show where we stand on this issue, so obviously we've got to be the counterpoint to that. Yeah.
So this oral hearing will be on August the 19th. Do you think we can get a vote on this before the election?
That's a challenge and perhaps not for the right reasons. There might be some way of bringing that vote forward.
Okay.
So either side might see some value in it. Obviously, it's the government of the day controls the passage of bills, but there's plenty of levers to pull. To me, politics is a very wobbly instrument to try and get an outcome. But that often offers opportunities as well to pull lots of levers to try and consider pulling to get something in. So it could be that most of the people against this bill will want to bring it in for a vote. And, it is very important to have the win in these outcomes, but it's also important to me, just as important to have the battle, to know where everyone stands and have some clarity around the issue. I think that's almost as important.
So the battle's
as the
really
outcome.
important. The submissions are in. There were 622. 98% were supportive of your bill, treating babies no differently to any other baby born in Queensland, even if they're the product of an abortion.
Yes.
So that probably didn't surprise you that they were so supportive, the Queensland public?
Yeah. Pleasantly surprised because you're just so used to the momentum going the other way.
Well, the way the media kind of reports on this stuff is they make it sound like we're the extreme when in fact actually most Queenslanders, the vast majority, would support a baby who's born alive receiving medical care. And that's all your bill seeks to do.
Well, and with your help putting it together, I think it's a really decent piece of legislation because it takes all the academic argument out of it and saying, well, we all acknowledge that's a human being alive, breathing the same air that you and I are breathing. So let's keep it alive.
So I think it's really good that you've done this because the inquiry with the submissions, some of them are really amazing in terms of what they acknowledge. So for the first time, the Australian College of Midwives has acknowledged this is a problem. So I've actually printed out a couple of them. And they've said that sometimes these babies are left for hours. And they've said that the midwives and nurses are the ones picking up the pieces, holding these babies. It's not included in their workload.
Yeah.
So they're not, because the babies aren't counted as persons, but if your bill passes, then they would be.
Yes.
So that's a really significant thing that the midwives have come out and said, this is happening, it's happening all the time, we're holding these babies. They don't count, and we need more help is essentially.
Yeah, we're so appreciative of them being brave like that. They speak their mind.
It was amazing. The nurses as well. So they did a joint submission. The College of Nurses, College of Midwives did, and they also said that too.
Yep.
It's really interesting. What I found really shocking was that RANSCOG, which is the Royal College for OBGYNs.
I saw your response to it. I hadn't read that. I get a bit wound up when I read all the
So they said the bill is unnecessary in that health professionals already owe a duty of care to all patients, including babies born alive.
Well, we wouldn't be having an argument if that was the case.
I mean, I just think, how could they be whitewashing this?
That's almost worse than disagreeing because you're acknowledging they must acknowledge that it exists, this issue, but they're trying to pretend that it doesn't, which is probably worse than opposing it outright.
Like, how can the medical peak body, RANSCOG, be trying to just cover this up?
It's more insidious,
I think, it is. Like they said, there's ethical guidelines already to cover this situation. And I know in the Parliament you stood up and talked about baby Xantha, born alive at 20 weeks in the Royal, 19 weeks it was, sorry, Royal Brisbane and Women's Hospital, lay there for 7 minutes without medical care.
Which is the ones we know about.
There's so
the
many
stories we know
more.
about.
Yeah, there are so. I spoke to a midwife today who told me about a baby in her hospital. 5 hours was alive for, and not entitled to palliative care.
Yes.
Or any kind of life-saving care. It's literally just the midwives took it upon themselves to wrap this baby and hold her for 5 hours.
I find it interesting with some of the submissions. I think I was reading the Queensland Nurses Union.
The union
that
I
said
know.
that women just you're impinging on their rights or just defaulted to one of those arguments.
Yeah.
Which would be an interesting one to pursue because we're now saying we're talking about a baby that could be 4 hours, could be 5 hours. Hypothetically, that baby could be 20, and they could still be because they didn't put a disqualification in there to say a baby up to this point. The woman still exercise the right. So we must assume that they say indefinitely.
Yeah.
The
Well,
woman
abortion is
exercises the
allowed
right
up
over
until
that.
birth for any reason in Queensland.
So now we're talking something triggered past birth.
Yeah. Yeah.
And it's alive, breathing in there, and they're still saying they should have the right. So the interesting question for me is when does that expire? Is it at 20 years old or 40
Peter
years old?
Singer, who's this so-called ethicist, he's a professor, he says that you should be able to kill a child up until 1 year.
Yeah, right.
And you should just be able to kill
I don't know
disabled
why
babies.
He wouldn't say 10 years.
Yeah,
then.
yeah.
I
Well,
mean,
he
I know
makes
it's all
this argument
I know it's all
about
philosophical,
aspirations, that a child after 1 year old can form connections and have aspirations. But you're a father,
Okay.
aren't you? Like we've talked about this before. You know that your newborn baby has a connection with you and your wife, right? She's carried that baby for 9 months.
Yes, well, okay, well, it's going down the philosophical path, but
it's insane,
we
isn't
need
it?
to default back to the reality of what happens, I suppose.
So you brought up the union. It is really interesting because the Australian College of Midwives and the Australian College of Nurses acknowledge it's a problem in their submission.
Yes.
And they say this isn't counted in their workload. These babies should be treated with dignity.
Yep.
And they even say they should get life-saving treatment if they could live, and it's basically treated no differently to any other baby. But the union, the Queensland Nurses and Midwives Union, their submission just accuses you of misrepresenting the facts. So they said, you're just using xantha for a emotional gain, and that's not what that story was about in the paper. They said, so that they are totally against the bill. It's just.
Well, it'd be interesting to introduce some of them.
They said you're being disingenuous and misleading. I mean, what do you think about that?
Well, I don't know how you can avoid not being emotive. My colleagues were tearing up when I was saying the stories, and I wasn't embellishing. I was reporting it as it came out in the media.
Yeah.
And it was pretty hard to read that stuff myself. So it was emotional, and that is a part of it.
Well,
but
it is emotional to hear of a baby being born.
But that's part of the human condition. I mean, that's why we're here, to care about people and care about things that, and especially the vulnerable. I find it weird that they would be critical of us having an emotional component or buy-in on this, because that's precisely what we're talking about. We care about vulnerable people, elderly, sick.
Yeah.
And
newborn
babies are probably the best example of our vulnerable.
Yeah.
Perhaps the highest priority in terms of vulnerability. So it's pretty, I mean, what a stupid thing to say that you're involving emotion in it. You cannot avoid that.
Yeah. I know, So I was pretty disappointed with Ranscog and the union submission, but then some of the other medical bodies seem to have broken ranks, and they're now acknowledging this is a problem. And that is the genius of this inquiry. This is the first time, I don't think you realise how significant this is, because we had a federal inquiry and the medical bodies all towed the same line. It was like they were just singing from the same song sheet.
Yeah.
This is the first time we have medical peak body submissions coming out. So 3 of the 6 have broken ranks and have said this is a problem and something needs to be done. So that is because of your courage in bringing the bill and us getting an inquiry. I know you get awkward when I start talking about courage, but I just think I want to say that because it is really important to acknowledge that you have managed to do this, and now this issue is being flushed out into the open.
Yes.
And it's really important.
I really, that's why I love interacting with people like yourself, because you can put a bit of academic rigour around it, and it's not that, we're not rednecks that just live in country areas or something. It's not that we're entirely naive or ignorant.
Yeah.
But I think you are conditioned, like where I live, to speak plainly and just see things for what they are and cut through the, this abstract sort of arguments that come in, like saying, oh, you could be infringing on women's rights or mothers' rights or something. It's like, you're killing a baby that's on a table.
Like at this point, the baby has already been born.
That are heart beating.
Yeah.
I think we can all agree that's not on.
Yeah, exactly. I think
there is no
that's
religious
right.
element to that.
No, it's just a human rights argument.
As you said when we first met, when that you know, we don't have to have a philosophical debate about kids being left to die on a table.
Yeah, that should be a non-issue in 2024 in Australia. Thank you, Robbie.
Thanks, Joanna.
Okay.
Thanks for all the work you do.
Okay.